Kira ora. My name is Alexis Balina. Kira ora is a common Maori expression used in New Zealand, which means be well or healthy. When I first told my friends and family that I was doing my internship in New Zealand, I was met with a lot of different reactions. Some people had no idea where I was going. Others thought I was headed down under to Australia. The few who had visited before told me I would find lots of sheep and possibly spot a hobbit. Yes, there were sheep, and no, I didn't find a hobbit. From green pastures to horizontal rain, what I did find was something new, different, and refreshing. But something I was surprised to discover was how similar New Zealand was to Los Angeles. Auckland is a diverse city with people from Europe, Asia, and the Pacific Islands, as well as the native Maori people. But in a city so diverse, similar to Los Angeles, there are also health inequalities. When it comes to health, New Zealand is not so different from America. Childhood obesity is very prevalent in both countries. An estimated 1 in 10 children in New Zealand suffers from obesity. Children living in the most deprived areas are 3 times more likely to be obese compared to the children living in the least deprived areas. Maori and Pacific children, in addition, have higher obesity rates than their European counterparts. During my internship at the University of Auckland, we aimed to look at the different factors that were contributing to childhood obesity, particularly its association with sugar-sweetened beverages. But instead of looking at beverage patterns through the traditional methods such as a food diary or 24-hour recall, we aimed to gain more objective evidence. Children from New Zealand were randomly selected to wear cameras for 4 days that took pictures every 7 seconds. Through this method, we were able to be flies on the wall. With those images, we focused on what beverages were in children's environments, what beverages children were drinking on a regular basis, and what beverages children were purchasing when unaccompanied by adults. More analysis is being done at the moment, but hopefully, with the presence of sugar-sweetened beverages in children's environment globally, this fly-on-the-wall method can be adapted to more countries. Not only can it give us more insight on childhood obesity, but projects on these images have spanned to looking at sun exposure, food advertisements, and screen time. The possibilities are endless. Although I felt a bit invasive at times looking at these images, they created an open door to New Zealand culture, as I was able to see what a typical day looked like to children, from walking to school, to climbing trees, to having dinner with their families, and everything in between. One image that stuck out to me was a classroom filled with projects pinned on the wall, and a word hanging at the top that read, Manakitanga. Manakitanga is a traditional Maori value that describes the act of showing respect, generosity, and care for others. This word stuck with me. This whole journey I have been met with Manakitanga, from my peers, professors, and sponsors at home, to the people I met in New Zealand. From someone who has lived in Los Angeles her whole life, this experience has opened my eyes to the beauty of global health, and I am forever grateful to the Drapkin Newman Foundation and the Fielding School of Public Health for the opportunity. As I have been shown Manakitanga, I also hope to show Manakitanga to others as I continue my public health career. Kira ora and thank you.